kilogram. So joule per kilogram, which is equal to gray. Okay, this is the unit of absorbed dose. But the unit of exposure dose is called Roentgen. Okay? Roentgen is the name of scientist who discovered the X-ray. Okay? Roentgen.
In German is Röntgen.
Yeah, in Germany. Okay? So this for exposure dose, the unit is Roentgen, but for absorbed dose is gray. But there are different types of radiation as we talked about last time. You remember that we have particulate radiation and photons. You remember that we have X-ray, gamma ray, and we have alpha particles or beta particles. So we have particles and we have photons. We have waves, okay? So X-ray and gamma ray, waves or particles? Waves, okay? So our body, like this square, okay? This square is exposed to gamma ray or X-ray, and same square is exposed to alpha particles or beta particles. Okay? The deposition of energy from alpha particle or beta particle is different from X-ray or gamma ray, because X-ray or gamma ray is highly penetrating waves, but alpha particles or beta particles can't move too much, so deposit all its energy localized in the same place. So the deposition of energy coming out from alpha particle or beta particles or particle will be higher than X-ray or gamma ray. Okay, so this is important for what? To calculate another term. It's called the equivalent dose, which get in consideration the type of radiation. You are exposed to alpha particles or beta particles. Sometimes in nuclear medicine, we are using radioisotopes, which emit alpha particles or beta particles. So now we are exposing to particle radiation. But sometimes we are exposed in CR or X-ray or CT to X-ray radiations. So if I want to calculate the effective dose, I have to know very well the source of radiation and the type of radiation coming out from the source. If X-ray or gamma ray, or particle radiation. It's very important for you. Okay? So now we will calculate the equivalent dose, which is equivalent dose will be the absorbed dose multiplied by quality factor. This quality factor is for the type of radiation. If we are talking about X-ray or gamma ray, this quality factor will be 1. So the equivalent dose will be equal to equivalent dose for X-ray and gamma ray. No difference. Okay? But for alpha particles will be 20. That means that the deposition of energy coming out from alpha particle is greater than the energy coming out from X-ray by 20. 20 times greater than X-ray or gamma ray. Because alpha particles, helium particles, heavy particles, deposit all its energy in each place. Sometimes using radioisotope, like it's called deuterium, in radioembolization, using this radioisotope to inject the hepatocellular carcinoma, using this radioisotope and using catheter, okay, to going through the femoral artery and to celiac artery and to inject the radioisotope yttrium-90 to deposit, because this yttrium-90 producing alpha particles, which deposit all its energy localized in the tumor itself without harming normal cells around. It's called radioembolization. It's application of radiation in medical fields. Very important. Nowadays we are using it. Okay? So, this for equivalent dose. So equivalent dose unit will be sievert. But now, all organs inside your body have the same sensitivity to radiation? All of them. Your bone marrow has the same sensitivity like your thyroid or your lung or different sensitivity, yes? According to the reproductions or, okay? Cells which is highly reproducible will be highly sensitive to radiations, okay? So now, according to which part of our body will be exposed, so we have another term, it's called effective dose. Effective dose will be equivalent dose multiplied by tissue weighting factor. Tissue weighting factor which is specific for different tissues. Okay? So now, if I send the patient to do CT abdomen pelvis and she's pregnant, if I want to calculate the dose, which term is important for me? Absorbed dose, exposure dose, equivalent dose, or effective dose? Effective dose, yes. Because this is last term, okay, contain all factors. So, you as a worker in CR, if you get the report coming out from outside for your dose, you will find the effective dose. Not absorbed, not exposure dose, not any other term, but you will find effective dose. This effective dose contains sensitivity part, okay, and the type of radiation part. Effective dose unit is millisievert or sievert. Sievert. Later on, or the next session, we will talk about, when we are talking about the biological effect of radiation, we will talk about the permissible dose for you as a worker. What's the permissible dose, okay, for you? If I get 10 millisievert or 2 millisievert, it's permissible or not permissible? It's very important to know what's the permissible dose.
For a single dose or for 1 year?
Yes, 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 yes. As a single dose or fractionated dose, yes. We will know this. Okay, but today, now, for CT, if patient comes to you and she's pregnant or child, and you want to check with technician, okay, what's the patient dose, or if this patient get higher dose or get low dose, so you'll find here very important term. It's called DLP. Any patient doing CT, you will get summary page. This summary page is available in any CT machines, okay? This summary page contains DLP, dose length product, or CTDI volume. CTDI volume, this is indication of CTDI volume dose per slice. But we scan patients. We have a scan lens. We are doing scan for chest or abdomen, so we have a scan lens, not only one slice. So we will multiply CTDI volume times lens. You will get DLP, dose length product. So if you want to calculate the dose of patient, you have to get DLP. You can ask your technician or X-ray technicians or CT technicians, okay, about the DLP. What's the DLP of this patient? He will give you the information. After that, it's finished? No. You have to multiply this value in tissue weighting factor. Tissue weighting factor to get the effective dose. So for any pregnant woman, if you want to know the dose for pelvis region, it's easy. Now, you will know the DLP for this region from the scan itself, and you will multiply it by tissue weighting factor, which is for pelvis 0.019, okay? You will get the effective dose. And you can compare this value with the tables on internet, it's permissible or not permissible. And according to the stage of pregnancy, okay? And you can take your decision. Later on, we'll talk in details about this. Okay? I think this is the responsibility of you and radiologists and physicists together to take a decision in this. Sometimes if pregnant woman exposed in radiation will cause congenital anomalies or malformations, okay, and sometimes in different stage of pregnancy will not get any effect. So here, different regions, head, neck, but sometimes we scan patient or we send the patient to do different parts together, not only one scan. For neck and chest, for CT abdomen and the pelvis. So you will have to take an average value of tissue weighting factors. And DLB will be summation of all parts. Summations of all parts, okay? For CT abdomen pelvis, okay, you will sum or you will get the DLB for whole scan, abdomen and the pelvis together. And for tissue weighting factor, you will get the average value. Okay? So if you are exposed, if you send the patient to do CT scan for abdomen and you will get DLB is around 800. How can you calculate now the effective dose? You can calculate it. Now you send the patient to do CT scan for abdomen and you get DLB is 800 milligray dot centimeter, because those lengths multiplication between those, which is milligray dot length centimeter. So 800 DLB from CT abdomen, and use this tissue weighting factor to calculate the effective dose. You can?
Yes.
It's easy now? What can I do in this?
Multiplied by the weighting factor for abdomen 0.01.
Yes, you're right. So if I send the patient to do CT for abdomen and the pelvis, and total DLB was 900.
So do you add the tissue factor and you multiply?
Take an average of tissue weighting factor between abdomen and the pelvis. Here from this table, abdomen 0.015 and pelvis 0.019. Take an average value of tissue weighting factor multiplied by total DLB. You will get the effective doses. Okay? I'm not going in details, okay? That's why I think this is important information for you, okay? These some parameters affecting on the patient dose. I'm not going. Okay. But for your information, if you send the patient, fat patient, and if you send the patient, thin patient, which who will get the higher dose? Thin patient or fat patient? Fatty patient will get the higher dose? Huh. Which one? Sorry? 10%? 10 one. Yes? Thin patient will get higher dose or fatty patient? Same parameters, same, with everything the same. Same scan length, everything. The only difference in body size. Huh. I think this is the only benefit to be fatty man, okay? This is the only benefit to be fatty man. The fatty